Heather. Hi, Christina. Good afternoon, everybody. This is Jessica Crejo with the Iowa Coalition for Integration and Employment, and a member of your Iowa Employment First Leadership team. Welcome to the Iowa Community of Practice on this beautiful, in some places in Iowa, snowy April day. It was snowy yesterday in Des Moines. It has since passed, but it sounds like it's definitely in Burlington, maybe a little bit in Dubuque. Let us know in the comments if you have snow today. Thank you to VR and the DD Council for their continued investment and leadership in the Iowa Community of Practice as they continue to partner with the Iowa Coalition for Integration and Employment to make that available statewide. Captions are available today. Please just click on the live transcription option or button within your control panel, and you can turn those on and those captions are available for you. We can also make the transcript available after the webinar as well. We will be sure to share the recording along with any presentation materials. I think in the chat, I haven't added it yet, but I will. I'll send you a link if you wanted to access Julie's slides immediately, or as she presents, I'll make those available to you. And I think without further ado, I'll just do a brief introduction here for Julie and Bill and then hand it over. So as our service system continues to evolve and poise itself to address competitive integrated employment, looking more closely than ever at things such as wages, inclusion, integration, and equity and access, right? How can we use existing policy to achieve competitive integrated employment for all Iowans with disabilities and all Americans with disabilities across the country? In what ways does existing policy create barriers to our success in doing that? And what policy changes should we be advocating for? And who better to kind of break that down for us today and help us with that discussion but Julie Christensen, APSE's Director of Policy and Advocacy, as well as their Interim Executive Director, and our very favorite parent and advocate, and coalition member Bill Stumpf, to help us kind of unpack the existing proposed legislation and policies and things happening around competitive integrated employment. So I think without further ado, I'll hand it over to Julie and Bill. Thank you both so much.
Thank you.
Welcome. Yes, thank you.
So I think I'm going to kick us off, but Bill, you know, you always have the right to interrupt me and tell the real story, right? Like I'm just a DC talking head now.
A good one too. So as you know, you're my go-to person.
So what we thought we would do is just spend a little bit of time talking about competitive integrated employment and where we're kind of at in the grand scope of all things federal and state policy to help achieve competitive integrated employment. And so I just kind of want to frame the conversation with a little bit of a reminder of what do we mean when we talk about employment first. And I always have to start here because, you know, I'm with APSE, and APSE is on the front lines of employment first. And one of the key pieces of, you know, or a key takeaway that I always want to leave folks with is that employment first is a movement. It's not a recipe, unfortunately. It would be great if it was, and we could just check the box and know that we would have equal opportunity for people with disabilities in the workforce. But we know that that's not true for a lot of reasons. And a lot of it has to do with just local context, right? Like we're a very diverse country. And so I'm gonna kind of ground to the best of my ability our conversation in Iowa. But that's why I need Bill, because, you know, Bill knows Iowa and keeps me honest. But when we think about employment first and we think about what is a policy goal related to employment first, what we're really talking about is making sure that employment in the general workforce is the first and preferred outcome of publicly funded services and supports. And there's a couple of key points to pick at there. We're talking about publicly funded services and supports. So where are our Medicaid dollars going? Where are vocational rehabilitation dollars going? Our mental health dollars, our veterans dollars, our, you know, federal procurement, Ability One dollars, that, you know, we are thinking about employment being the first and end goal that we want to get to, because we know, all of us working in this space, that that's the beginning, right? Like employment is what allows for everything else, you know, better healthcare outcomes, you know, better community participation, opportunity to live in the community, participate. You know, we even have recent data linking employment in the community with higher rates of voter turnout for people with disabilities. So there's a lot of pieces and parts around why employment is so critical. But we want to be thinking about it from the perspective of not just check the box, get a job, but is it meaningful employment? Is it fair wages, meaning people with disabilities are compensated at the same rate that anyone else would be for doing the same work, that there's career advancement, and that it's really, we're talking about participation in the full labor market. So what I wanted to just, I'm going to do a very quick history of disability employment. And the key takeaway to this is that when we talk about public policy, which is what Amy and Jess asked me to focus on, is, you know, what's the public policy plan, roadmap for competitive integrated employment. And we kind of have to recognize that, unfortunately, policy is always reactive. We would love to think that, you know, we live in a proactive world where we see the barriers and we work collectively to address it. But the reality is that policy, when we talk about big P policy laws that filter down into regulations and so on and so forth, is always reacting to something, trying to make something better. And so when we think about disability employment, we were a farm-based economy, right? Everybody participated. Then we had the Industrial Revolution, this huge shift to cities, this, you know, the idea of machining and manufacturing, and it changed the way we thought about participation in the labor market as being about, you know, productivity and, you know, being able to match specific skill sets to specific job requirements and outcomes in a very different way than what we were used to prior to the Industrial Revolution. And with that came a shift in recognizing that we didn't necessarily have the tools at our disposal at the time to encourage and support people with significant disabilities to develop those tools and to find those matches. And the workplace in and of itself, as we were evolving, was not inclusive, right? And so therein became the need for what we now fight so hard against in terms of institutionalization, which came from a legitimate desire to take care of people. It came from the idea that we were doing the best that we could with what we knew within the context of where we were as a country at that time. We had a significant turning point when we got to World War I and through into World War II and up into the 70s, where we really started to see the need to create a support system that wrapped around our returning veterans. And so we talk a lot in the Employment First space about the Fair Labor Standards Act in 1938. If you're an Ability One provider, you're very familiar with the Wagner-O'Day, now the Javits-Wagner-O'Day, or otherwise known as JWAD legislation. And we talk a lot about the context of 1938. And what is important to understand is that in 1938, again, we talked about the Industrial Revolution and that this moved us to a model of finding safe places for people with disabilities to be, because we did not have a workforce that had figured out how to include them, right? So then we had veterans returning from war who were coming back. They were part of the workforce, but they were coming back with primarily physical disabilities, maybe blindness, maybe deafness, definitely mental health, although that was not a factor at the time in 1938. And we needed to wrap supports around them to help rehabilitate and retrain so that our returning veterans could re-enter the workforce. This was a game changer. We were not, as a country, talking about employment for people with disabilities before that. And so it can be easy in the context of 2021 to get stuck and to say, man, we still have this law, it's 50 some odd years old and it's not relevant. And that's all true. But it is relevant in the sense that it's our history, right? It was the beginning of a conversation as a country to think about where people with disabilities play a role in our workforce and what we need to be doing structurally as a society to ensure that that could happen. Bill, you took yourself off mute. I think you were going to say something.
I did. Boy, you can read me. You know me well. This is what has, and honestly, I've really just learned this in the history in the last few years. And, we obviously knew what the Fair Labor Standards Act was and everything. And, it was about jobs and minimum wage, but I never really got the link. And that's a piece that I needed. And so in terms of advocacy, what I have done, and even talking to other families, when I talk about, getting rid of 14C, tell them the history of it, much less than what you've done an amazing job in doing that. And I love that. And I think so I try to do that in a capsulized version, because I don't think people realize that that's what evolved into sheltered workshops. And the factors aren't the same anymore. Right. Supports weren't there. And I think that's the part that folks don't understand totally. So whether I'm talking to a family member or a legislator, I try to point that out, because quite frankly, I think there's a lot of legislators out there that don't know the history like that either.
Correct.
Just a guess, but I think it's probably a good guess. So I just wanted to jump in and just kind of share from an advocacy standpoint. That's how I advocate now. So that's certainly changed from how I used to. Thanks, Julie.
Well, and Bill, to pick up right where you left off, this next slide is just a quick timeline, right? So I started off by saying policy is always reactionary. 1938, we started talking about people with disabilities in the workforce through a rehabilitative model. It wasn't until 1971 that we amended those laws to include people with intellectual and developmental disabilities. That's relatively recent history, right? That's when what we know today as the sheltered workshop system came into being, in recognition that at this point where, 25 years in post Fair Labor Standards Act, and still not including every person with a disability, people with significant disabilities were not included. The Rehabilitation Act came 2 years later. And when we think about the service delivery system, as much as law is reactive, our service system is reactive to law. So it's even that next step behind. So I have so much empathy for our providers who are kind of in this situation where they inherit funding streams and they inherit rules, and ways to engage, and have to figure out how to do the best they can with that. So, we start to think about people with significant disabilities. We develop a sheltered workshop system. Again, in its context, the first time people with significant disabilities were provided opportunities to train for the workforce. We then get the Rehab Act a couple years later. Supported employment starts to develop, and so on and so forth. We don't get civil rights for people with disabilities till 1990. That's again relatively recent in our history, and then needed another 10 years of sorting through, post the ADA, what does it mean to be a person with a disability and to have rights to live in the community, which is where that critical Olmstead decision from the Supreme Court came in, and also around the time we started talking about customized employment. So, again, as laws evolve, as our thinking evolves, and then our service system evolves as our laws and funding streams allow them to. And that kind of brings us to where we are right now. So 2014, we have a SIA bill, the Workforce Innovation and Opportunities Act, which sets the stage for competitive integrated employment, which is what we're going to talk about next. But also when for Medicaid services, the Home and Community-Based Services final rule came into being, ABLE Act, the first time we started to really think about what legislation we needed to allow for people with disabilities to save money. So it's great that we are helping people get to work, but if they risk losing, their benefits and their access to healthcare and all of those other pieces and parts, then we're doing more harm than good. So I'm going to throw up the CIE slide and then let Bill jump in here.
Okay, just another comment that I think folks don't realize either, and again, you highlight that awesome. Go back to 1938, folks with intellectual disabilities and probably even significant physical disabilities were probably institutionalized. I'm sure there's cases, and I don't know the data, but I'm sure there's families that embraced that and kept their loved ones at home. But by and large, I think they went to institutions. And so I think it's another point to make. But again, and just to reiterate, I've learned that rather than going in and throwing everything at them, give them the history first, and then I think they have a better grasp on it. But thank you.
Yeah. So we now have this definition of competitive integrated employment. And prior to WIOA, we had different pieces and parts that took on different aspects of it. CIE is a pretty broad definition. And so the language is here, but I'm going to actually switch to the next slide because I am a visual person. And so this is what helps me understand what we talk about when we think about competitive integrated employment. And I am going to make the note that we, in this presentation, we have pre-pandemic data. Although I did provide the most recent 14C data for comparison, but the pandemic itself has really created a whole other set of issues that we're still just beginning to figure out. And so when we think about from a kind of a data perspective, we're looking pre-pandemic until we have a better understanding of what is COVID specific in terms of outcomes for competitive integrated employment. But, I kind of like to break it down into the competitive, the integrated, and the employment. It's probably the only part in my day-to-day existence where I'm okay with silos, other than I put them all back together at the end, right? But when we think about competitive integrated employment, the C in my world, this is the world according to Julie, which only matters to me, but maybe this is a helpful way for some others to think about it. So for me, the C is about the wage. It's about making minimum wage or comparable wages. competitive employment, that you are compensated for the work that you do. And that's where the 14C debate comes in. And we'll talk about that in a second. Integrated is the setting, right? So, not every 14C and sheltered workshops, we use them interchangeably, but they're not the same thing. And so it's also helpful, especially if we're advocating in the 14C space, to make it clear that we're talking about wages. It's a wage issue. It is not a settings issue. There are no rules that say that 14C in and of itself, having a 14C certificate, which allows you to pay someone sub-minimum wage, that there's any rules where that happens. All that 14C certificate says is that you can pay below the minimum wage. So integrated is about the setting where employment happens. Is it in the community? Is it in a facility? The best way we can track that, with all of the flaws that exist in all of our national data sets, is through Medicaid data. So it's not a perfect number, but it gives you a sense that nationally we still serve, the majority of folks are in facility-based services for employment, not out in the community. And then, of course, we all know, or we wouldn't be on this call, that there is a significant gap in the labor participation rate for people with disabilities. So that's the big E. So we can kind of conceptually understand what all of these things are, and each of us at different points in our own trajectories have been involved in the work in one or more pieces of this, right? We're all doing the employment piece, but some of us may be more involved in, for example, the Medicaid system and the home and community-based settings rule, which is that middle silo. Others of us are really engaged in the 14C piece. But the important thing is that what WIOA did was took these three individual concepts and smooshed them all together. Smush, that's a new word. And has put forward that our gold standard, what we should be working towards, is that individual competitive integrated employment, so jobs in the community, where in a perfect world, as much as I know that APSE largely represents many providers, but in a perfect world, people don't necessarily need us, right? Like, they are able to use natural supports and compete in the job market. And if they do need those supports, that's totally fine. But we tend to find that the reason that supports are needed is because there's still a disconnect between the environment where work is taking place and what an individual is bringing to the table. And so there is a continuum. And so I'm really clear, and I'm always hesitant when I use this slide, and it's evolved over the years, in saying, that what APSE believes is that if you're anywhere on this continuum, you are welcome at the table. We are a big tent organization that it's all about that path to employment. But we always have to put first and foremost in front of us that CIE is the goal. And that's what we're working towards, breaking down those barriers to get there. And so then how do we do that from a public policy perspective? So in the same way that it's helpful to kind of think about CIE from a data perspective in silos, we also can do that in a policy perspective. And there is overlap, a tremendous amount of overlap, but also, again, when we're talking about competitive employment, we're talking about eliminating 14C under the Fair Labor Standards Act, getting rid of that exemption for people with disabilities from the minimum wage, which, by the way, there are many exemptions from the federal minimum wage under our current labor law, but there is only one exemption specific to what in every other aspect is a protected class under our civil rights laws. And that's what 14C does for people with disabilities. There are no protections under our civil rights laws for being a tipped worker, for example. Tipped workers are not a protected class. People with disabilities are a protected class and is the only population covered under our civil rights laws that is exempt. Also, the transformation of Ability One, which APSE has increasingly been working in this space, because we do recognize that there's a tremendous amount of money and opportunity within the federal procurement space that allows opportunities for jobs for people with disabilities. The question is, are they competitive jobs? And are they integrated jobs? I actually should put that one in both columns, in both the competitive and the integrated column. But from an integrated setting, implementation of WIOA, compliance with the home and community-based settings final rule, those are the mechanisms we have to really look at the integrated aspect of work. And of course, there's many things that we can do on the employment front. But one of the things that we have to think about when we think about those policy barriers is that, interestingly, when you look at WIOA and full implementation of WIOA, which again includes the C, it includes the competitive, we actually cannot fully implement WIOA as long as 14C remains in law. It is in direct violation of that competitive mandate in WIOA. The reason that's important now is that WIOA is not a perfect law. Well, there's no such thing as a perfect law. You will be hearing more and more in the coming months that reauthorization for WIOA is front and center in Congress right now. And there are things that we're worried about with that. But one of the things we're most concerned about is that before we can do real reauthorization, tweaking, improvements to the law, we have to eliminate the barriers that keep WIOA from full implementation. We have to do that work first. And that's the 14C phase out piece that we'll talk more about. I'm going to keep going because Bill is still on mute. That's my what I'm checking in with.
I will jump in. I just, that's another piece that in terms of my advocacy has evolved as well, is talking about just the fact that somebody might be paying above minimum wage doesn't necessarily mean they're integrated. And I think, and again, not to throw it in their face, but to explain that to them too, that it's not just about making a fair wage, it's also about being included. And that's a piece I think that's worth explaining. Thank you.
Yeah, and that's exactly right. It's to be competitive integrated employment, it has to be all of them, right? Like it's all of those pieces. So I'm just going to deviate slightly to talk a little bit about the last year, because this is a critical piece of the public policy discussion in the employment first space. The COVID-19 pandemic has had a significant impact. We know that. I know I've had the great honor of being in several meetings with IC and the Employment First folks in the state of Iowa over the last year. So this is not going to be new information. What I may or may not have talked about in past presentations is the second pandemic, quite frankly, that we have been facing in the last year, in looking at the disproportionate impact of bad policy on people of color. And that is a critical component in the employment first space. And the reason it's a critical component is that we can talk about the labor participation rate for people with disabilities and the gap. But if you happen to be a person of color and have a disability, then you can see from the chart on the right-hand side, the outcomes are the lowest of the low. And so we can't do this work of really talking about equity in employment for people with disabilities if we're not talking about all people with disabilities. And so we're pretty comfortable in the disability space with concepts of universal design, right? Like that's something we feel good about. And when you plan for people most significantly impacted, everybody benefits. We have not necessarily, as an employment first community, used that same thought process when we think about race and ethnicity. And so where are we as we are moving forward out of the COVID pandemic and rebuilding our service systems and our local economies and, in creating whatever our new normal is going to be, to make sure that we are being really intentional, that we have left people behind, and that they have to be front and center in all of our work in this space. The other piece that is a critical juncture in this past year is the role of technology. And we know we've had to adapt to remote supports just because of the factor of health and safety and needing to work from home. And there's both benefits and there's both cons and pros, right? Is that what I'm looking for? Pros and cons to the use of technology. And that's a whole other presentation we won't get into today. But what is important is to recognize this isn't going anywhere. This is here to stay. In some way, shape, or form, our work in the employment first space, our work in providing employment supports for people with disabilities has been forever changed. And in fact, it's interesting when I started doing the history of disability employment and talking about the Industrial Revolution and what a significant change that was pre-pandemic. And the reality is COVID-19 is our generation's industrial revolution. The work that we do is never going to look the same moving forward. And so what does that mean? Recognizing that our policies are not up to date, whether that's big P policy or little p policy, I mean, to what extent, if you're a provider, to what extent is there mandatory technology training for your staff so that job coaches and job developers know how to even use technology to effectively provide good supports and services. And then add to that we know we had a workforce crisis prior to the pandemic, and just thinking about employment supports, which is what this data shows, we're projecting, it's actually a little bit higher now, but around a 25% overall loss in the workforce of just job coaches and job developers. At the same time that we are having these conversations about the use of remote and virtual supports that are here to stay. And so there's good news, bad news, right? I mean, one of the benefits of technology is that we have figured out in some ways how to be more efficient. We've been able to get supports to really remote parts of Iowa that, previously were underserved. But there's a real tension when I look at this slide between the danger we're in of allowing technology to become what takes over for that personal expertise that we know the employment first community, our job coaches and our job developers bring to the table to help break down barriers to employment. And that has to be part of the public policy conversation. So here's where we're at as a national organization. And this is same information that I had a few slides over, but we are working in all three spaces: the competitive, the integrated, and the employment. And we specifically have a couple of key priorities that we're looking at. Phasing out 14C and sub-minimum wage is first and foremost. And I'm going to give just a quick update on where things are at in that space, because every day is a new adventure. We are also looking, yeah.
Can I just add on to the last piece a little bit? I think too, and technology, I mean, sometimes when we start to look at that, we automatically assume that it's going to work for everybody. And I think there's danger in that. And that's exactly what you're talking about, I think. And,
yes.
and also I think another piece is employers. I mean, we've just finally got to where we are starting maybe to see, I think we have a ways to go, but employers accepting the fact that they have a job coach in their building as well. And now we're going to tell them that job coach may be an iPad. And so I'm not to take away from it, because I think it's going to be extremely beneficial. And some of the programs I've seen are amazing, but it's not going to be for everybody or every employer.
It's not. And thank you, Bill, because it's another piece of the tension in the slide that, I didn't touch on because in my brain I had, but I had not said the words, which is what we don't know is when it doesn't work, right? Like, how do we make that assessment that this is that there's something going on, and this can be a quick FaceTime conversation between job coach and supported employee, or this is something that needs that job coach to hop in the car and drive out to that location to be person to person and hands-on. We have a lot of work to do to understand what happens in different situations that require us to have different approaches in how we deliver services. And when we think about less and less staff and more utilization or reliance on virtual supports, that's something that we're really concerned about. I'll layer on even a different piece of this, which is, it's interesting, one of the benefits out of COVID-19 that the disability community has been really excited about is the acceptance of remote work and the ways in which remote work is opening up new opportunities for employment for people with disabilities. And so we used to talk a lot about remote work being a reasonable accommodation and employers not being willing to allow remote work, which of course now is not the case. But here's the challenge, right? When we talk about the integrated part of competitive integrated employment, is it really more integrated if we are relegating people with disabilities to working from home because that's easier than adapting our physical work location to be fully accessible? So, it's finding the balance of these things and just always being willing to ask the hard questions. Yes, there are going to be more opportunities for people who can work from home, who don't have access to transportation or have, really significant healthcare issues that could be put at risk if they are having to leave their house. All of that is legitimate, but not at the expense of holding our communities accountable for being accessible so that people with disabilities who want to go to work every day alongside everybody else have the opportunity to do that.
And there's that social connection piece, and that's been big for Kyle and meeting people, and has maintained at least a small level of contact with some former coworkers, not lots, but some, and you could lose that as well. And we all, some more than others maybe, have social connections at work, and it's part of the I think.
It is. And, I know when earlier in my career, when I was running project search programs, I remember making the point that, if we are helping young people transition out of school to a situation where they get up in the morning, they hop on the bus, they go to work, they work their 8 hours, they hop on the bus, they go home, and that's it. Have we really done our job? Yes, we got them a job. Yes, they're making an income. But what about the rest of their life? Because depending on your workplace, there may not be a lot of opportunity for engagement and getting to meet people, or it's relegated just to that sort of, your work hours and the interaction of being a coworker, and not really developing peer supports and friends and a sense of community. So yeah, Bill, as Eva said earlier, a little louder for the people in the back. So I have listed here our federal legislative priorities and the bills that have currently are introduced that we are working on. But I wanted to just do a quick update on what's happening with all things 14C. And this even as of this morning has changed. Anyway, so we have a couple of pathways on the federal side. The Raise the Wage Act, I know we've talked about in other IC coalition meetings. This is the broader $15 minimum wage package that also includes elimination of all the exemptions from the federal minimum wage. So whether it's tipped workers, agricultural workers, 14C, all included in that package. What we have been working more closely on is the reintroduction of what was the Transformation to Competitive Employment Act, but is now the Transition to Competitive Integrated Employment Act, which was reintroduced in the House. The Senate has a companion bill, but no Republican co-sponsor yet. And we're working on that. And the Senate is not going to reintroduce without that bipartisan support. But that is that phase out that we've been talking about, not pulling the rug out from under individuals who are in 14C settings, but that it's a multi-year phase out over time that helps provide supports for providers, for communities, for individuals impacted and their families in thinking through what that transition to competitive integrated employment should look like. The current version of the House bill is a little bit different from what we've been talking about in the last Congress. It used to be a 6-year phase out. It's now basically a 4.5-year phase out. So a little bit more expedited time frame. In the midst of all of this, the American Jobs Plan, otherwise known as the infrastructure bill that we're all hearing about if we have a smartphone that buzzes every 3 seconds, includes, among other things, the phase out of 14C. This is significant because this is the White House including as their priority, not just a congressional piece, but a White House priority of eliminating 14C. And it's a pretty substantial ask. It's the line item is not out for the public, so don't quote me, but it's a $2 billion phase out of 14C included in the American Jobs Plan. What that's going to look like by the time Congress does its Congress things to make things become law, you know, we will see. What is new is that we are anticipating perhaps as early as tomorrow that there will be a compromise minimum wage package that will be introduced, that it's sounding like they're going to land at $11 an hour as the minimum wage instead of the 15. There have been a couple attempts at this. Most recently, Senators Romney and Cotton put out a compromise bill, but it kept 14C intact. It's meaning 14C was not going to be phased out in that piece of legislation. What we're hearing, but not able to confirm yet, is that 14C is included in this new compromise bill, but not at the $11 an hour minimum wage. And so they're essentially setting a, I always get my floors and ceilings confused, but basically saying you can't go below. So I guess that would be the floor. Can't go below into the basement below a certain number, but I don't know what that number is. It's just not the $11 an hour, which is progress, but it's still, you know, saying that people with disabilities don't deserve the same minimum wage as everybody else. So more to come on that. As soon as we know more, we'll be getting it out through networks, and obviously Jess and Amy and Bill and others on this call are, you know, some of the first people we reach out to when we know new things. So there's a couple of different options for 14C. In the interim, it does look like WIOA reauthorization will move forward. Depending on who you talk to, the House seems to think they can do this. Protecting Title IV. Title IV is where the CIE definition is. It's the 511, which also contributes to 14C phase out, section 511, and some other pieces and parts. And so the House seems pretty confident that they can protect Title IV. It does not look like that would be the case in the Senate, but senior staffers with the Senate Help Committee yesterday made the comment, and I actually wrote it down because I thought this was interesting. Republicans don't want to keep 14C. It's not a mainstream policy goal. And I thought that was really interesting because I had never heard that quite articulated that way before. So we'll see. We'll see what happens with that. So a lot to kind of pay attention to. In the meantime, on the state level, just last week, we officially have our 6th state that has phased out 14C. Governor Inslee signed legislation in the state of Washington. So Washington becomes the 6th state in the country to eliminate 14C by state legislation. And there are 10 other states right now that have legislative proposals this session to also look at 14C phase out. The general consensus is that we are not in a space anymore of talking about if we're phasing out 14C. It's a matter of when, and more importantly, how we do it. And that we do it in a way that is purposeful and cautious, and keeps people with disabilities front and center in not being harmed by a systems change that is long overdue. So I'm going to give you guys some homework. Some things to think about. So I included in the slide the latest data for CIE. I did want to note, because it's always tricky to report 14C data because of the way that Wage and Hour at Department of Labor records it. At any given time, there are pending certificates that are not counted. And so we never really know, exactly how many people. But as of January 1st of 2020, there were 9 certificates with 635 people. A year later, 17 certificates with 1,000 people. But if you adjust those numbers to include an average number served for pending certificates, then what you really had is somewhere between 19 and 20 certificates in the state that a year ago were serving about 1,400 people, and now we're serving about 1,200 people. So even in Iowa, we're seeing, it adjusted for pandemic and other factors, we're still seeing a decrease in the utilization of 14C, but 1,200 people is still a lot of people. And so, how are we wrapping services and supports around those 1,200 people to ensure that they are not only on a path to competitive integrated employment, if that's their choice, but that they have wraparound supports to have meaningful days, and that those opportunities are available for them within their communities. So where I will leave you guys with homework is that I know probably more than any state, I will say, you guys have so much going on. And so, one of the things that I will leave you with is that not every state is in a place to take on competitive, integrated, and employment all at the same time, right? You guys are going to have to really look at where there are activities already in place that are making an impact through ICE, through your Employment First initiatives, and figure out how you can leverage some of those things. Thinking through what are the barriers, what are the opportunities, because you may be able to make great strides in integrated employment, but maybe not so much on the competitive side right now, or maybe the opposite is true. I don't know. You guys know best what your context is right now, and what the next steps will be. But really thinking about it again, that this is a movement. This is picking away incrementally towards that end goal that we want, which is competitive integrated employment for everybody. And where can you get the most impact with where your state is at. So, Bill, what words of wisdom do you have to kind of leave us with?
Wow. That last piece again, Julie, and I think is what we can do now. And as I think back in prior to the start of the legislative session here, my senator actually said, is there anything we should be doing on employment? So just the fact that she brought it up, I thought gives me some hope that, although things are kind of polarized in Iowa right now, to say the least, but that's on her mind. And so I think I'm kind of thinking out loud here is perhaps next year, at the start of the legislative session, maybe get a group together to meet with some key senators or representatives in Iowa and say, here's where we want to go, and maybe get something introduced. So I'm talking to everybody, I guess, and let's maybe start a conversation about that, because it just, as you were talking, that popped into my head. The other thing, you mentioned wraparound services, and I think that's so key. And just the fact that day habilitation is also evolved and is still in the process of evolving to become more inclusive and include volunteer activities, and volunteer activities often lead to competitive integrated employment. So I think just day hab in general looks so much more inclusive than it did. And as for us, I know it, and for Kyle, it certainly was beneficial and still is due to his decreased hours. So he still is accustomed to going somewhere every day. And he's quite enjoying it, to be honest. And so, yeah, I just think, yeah, that day hab isn't anymore, and I don't know if it ever really was, just sitting in a recliner somewhere watching TV. There's lots of engagement going on. So I guess that's my words of wisdom. But I really do want to emphasize, let's let's get a group together and have a conversation prior to the next legislative session, maybe in the summer, and maybe we can meet with some folks and say, hey, we'd like to see this introduced. And it happened in Washington, so Washington State. So yeah. Who knows?
So another little piece of homework, you know, in addition to thinking through where you have activities already going, what are the opportunities? What Bill was just talking about, what are the barriers to overcome? You know, this is work that you guys can be doing as a coalition. And now is the perfect time to do it, Bill, you know, because before we know it, the next legislative session will be here.
Right.
So I will.
That seems to happen in Iowa from my perspective sometimes is, and I'm guilty of it as well. We get into the session and everything's already pretty much framed what they're going to do. It's that summertime and springtime prior that we need to start having these conversations. So I'm open to that if folks want to start to look at that and let's start having some conversations and also to educate again. And I'm going to jump back to that on the history, because I would think that there's a lot of folks in the legislature that just don't understand that history. And I think if we arm them with that, they may have a different opinion. Maybe I'm being Pollyanna-ish, but I just think education is so important to learn the history and go. So I'm looking at everybody on the call. Let's start this. Let's start some conversations. Thank you, Julie.
Thank you, Bill. And thank you, and
thank
Jess, and all of my fellow Iowans. I still claim the state, even though I wasn't there very long.
We would like you much better
We
now
still
if
claim
you would
you
send
too,
some of that beautiful Washington springtime weather this way.
Next week, hopefully, right?
Yeah.
Just sharing some comments from the chat, you know, just some thank yous, you know, and great presentation. But again, folks just kind of validating or confirming that they too are seeing and hearing folks shifting from sub-minimum wage employment into day hab services and maybe not using it as a wraparound, but as kind of the landing point. But again, folks being hopeful that with our changes, our expansion or of our day hab rules, right, to include that pathway to employment, that might look a little different. And totally agreed, Bill, that would be a great conversation to embark on and start this summer, right, as a coalition, as a state. I think it's a great idea. Any other comments, questions, reactions, concerns?
I'll just say thank you all for the work you do every day. Truly.
Thank you, Julie. And you know, I wanted to say we still claim you as an Iowan, so
we do.
You can be an Iowan all the time. Yes, we're not letting you go.
I will
I put the evaluation. Go ahead, Bill. Sorry, go ahead.
I will
you're fine, please.
Julie said, and you all are the people that are in the trenches that are putting all these policies to work. I just say, hey, this is a good idea. Let's do it. And I like to see somebody pick it up, but I definitely want to partner with that and lend my voice if I can. And if they're not listening, I'll hide, you know, let somebody else. But I do appreciate that. And, you know, I mean, many of you know Kyle's story and my story, quite frankly, of evolution into competitive integrated employment. And I was a naysayer not too many years ago. And it was, again, I say it all the time, things were comfortable. He was going somewhere every day. But when you sit down and look at the future of that, and I mean, I'll throw in the ABLE account information, Kyle, I don't think he'd care if I told you how he's already got $8,000 in his ABLE account, and it's just a couple years, you know, and it's amazing. And that wouldn't be happening to that level had he not been making at least minimum wage. So that's a success part of it.
That's incredible. Well, and I think the community of practice is a great place, to Julie's point, you know, this is a great platform to talk about those barriers and opportunities, and to let us know, kind of the royal us, the royal we, right, kind of at a state or systems level, you know, what you do need to achieve integrated competitive employment outcomes, and to serve those with the most significant disabilities, or have complex lives, complex support needs. You know, this is a great platform to kind of share what those needs are, where those gaps are. We can, you know, continue to take that back to a state level, to the Employment First team, to the coalition, and continue to talk about those, right, and unpack those, and leverage our resources and our opportunities around that. So, because as Julie said, there's a lot going on in the state right now, still, right? So, well, I think if there isn't any further questions, comments, reactions, anything else to share, we could probably end for today. I encourage folks to please complete the evaluation if you haven't already. And we are back in May, on May 18th at 1 p.m. And, oh, my schedule is hiding behind my screen here, but I will be sure to send out that invitation. I'll be sure to send out the recording and the materials for today, and get you a reminder and the registration out for May as well. So thank you so much, Julie and Bill, for a great discussion today. Thank you, everybody, for joining us. Have a great rest of the week.
Yay!
Yes, love it.
Bill's my favorite billboard.
Yeah.
I love it.
Unincluded.
Thank
Well,
you,
and another
Iowa
plug
APSE, for that.
Yeah. I was going to say another quick plug for APSE, right, Julie? Your conference is coming up and registration is open, right? And we
8 weeks.
It's unbelievable.
We'll be here tomorrow.
Right? I was going to say that's, that is tomorrow. All right. Well, everybody have a great rest of the week. Take care. And we'll see you back in May 18th at 1 p.m. Thank you. Thanks, Bill and
Bye,
Julie.
Thanks, Beth.
Take care.